sponsored by the Springfield Clinic. In the studio today, we have Dr. Elijah Kim from the Springfield Clinic. He is a trauma surgeon from the Springfield Clinic. Thank you so much, Doc, for joining us this morning.
Thanks for having me.
Talk a little about trauma surgery. What is it? It's something that's very important within our hospital systems.
Definitely, yeah. Trauma surgery is to care of any injured victim. Nobody really wakes up expecting to be in some kind of injury, whether that be motor vehicles or even a fall at home or a laceration. And trauma surgery begins on the field. Once the police or fire or EMS arrives, they're in constant communication with us in the hospital, giving us updates about the patient and his or her condition. And then once they arrive to the hospital, there's an entire team that comes together that prepares even before the patient arrives to the hospital to get that patient out the door as quickly as possible in a better condition since when they arrived.
Gotcha. So you are the first person to see them typically in the hospital, in a hospital environment. Talk a little bit, has traumas increased over the years? Have we been seeing more of them?
Traumas have increased. The most common traumas are motor vehicle accidents and motorcycle accidents. In that aspect, the severity of some of our accidents have decreased in the sense that there's more safety equipment in all of our vehicles today. Certainly the older vehicles, we tend to see more severe injuries. But even the accidents, whether they be falls or lacerations, nothing really can change humanity in the sense that accidents happen.
Yeah,
so.
I'm sure time of year too of motorcycles, people going out when it's warmer,
That's right.
You'll see more motorcycle accidents. I want to talk about how your job is changing. Robotics is playing a key role in the changing scope of trauma surgery.
Yeah, absolutely. So robotic surgery began as a collaboration between the Department of Defense and the NASA space program. It was initially meant for remote surgery in a forward operating base or patients who were in traumatic moments when doctors can't really administer care. The beauty about robotic surgery is that the surgery can be made through incisions that are only 8 millimeters wide. That's not even wide enough for me to fit my little finger through. And last year, Springfield Clinic and St. John's Hospital, we made history in doing the first robotic pancreas surgery on a patient that was able to preserve the spleen. And earlier this year, we made history as the first hospital in the country to operate on a diaphragmatic and a pericardial rupture in the heart.
We did a story about that. I remember hearing about that. So it's very, very awesome. I'm sure you guys will be planning more things as far as robotics go ahead, right?
That's right. Yeah, we're super excited. We're developing our capacity. We've expanded. We've done a multi-million-dollar expansion to our operating rooms. And I think as we go forward, we're transitioning and translating that surgery, that robotic platform, to all kinds of surgery. So now we can do that for cancers, colon cancers, stomach cancers, all the way down to even your standard appendicitis.
Okay, great work that you guys do over at the Springfield Clinic. Thank you so much for being here. He has to go do a surgery today, so you can get out of here.
Thank you, Justin.
Yes, thank you, Dr. Kim. All right, next on Good Day, Illinois.